Aloha! Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa at patuloy na pagtangkilik sa Healthy Mondays. I'm yours truly, Dr. Mary Faye Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Maraming salamat po sa inyong pagtangkilik sa aming programa at patuloy na pasusunod sa aming Healthy Mondays. Tonight will be a special broadcast because it's going to be a live So tonight, mga kababayan and listeners out there, tonight we will be broadcasting my personal and professional experience hands-on in volunteering at the vaccine clinic here at Roseman University of Health Sciences in the Summerlin campus. So I will be with my nursing students and supervising them as they take on the role as vaccinators. So stay tuned, and we will be sharing with you some video snippets. And of course, we're not going to be able to show you the participants for their rights for privacy, but I will be asking some of the students and also some of the faculty and volunteers if they would like to say something to the public. The purpose is to encourage the community and the public to get their vaccinations. So stay tuned. I will be right back. And here is the front of Roseman University of Health Sciences in Summerlin campus. And this is the entrance for the check-in as we prepare for the vaccine clinic for the day. So I'm an early bird. So this is where the check-in is going to be. I'm still waiting for my nursing students. So we'll This is our meeting room for our pre-clinical and post-clinical conference. And the students are taking a break here after we had vaccinated. And this is our pre-briefing with Dr. Delas Jones as he prepare everyone in our team for the vaccination. And this is Dr. Fred Calixto, who is one of the faculty at Roseman College of Nursing. He's also a founding member of the APINO of Nevada. And this is our room where we retrieve for to take a break. And the students are preparing their tables, respective assigned table. And these are the pre-vaccinator prep as they prepare the vaccinations that's going to be administered by the nursing students. And again, some of the faculty and students volunteers as they prepare their respective assigned tables as the people come in and the community comes in for their vaccinations. And here we are taking our lunch break, donations from the community. And this is the incoming group of students who are going to vaccinate in the afternoon. And this is when we have our preclinical conference to prepare them. And here they are preparing their respective tables. And this is when they are actually administering without showing the participants. And I'm sorry about cutting some of the pictures.
Hi, I'm Gabrielle. I'm a student at Roseman, and I'm here at our Roseman clinic administering COVID vaccines to the community. I'm really thankful for my school to hold these clinics, to be able to administer vaccines to everyone, teachers, 70 plus, and the medical field. I feel like it's a very rewarding experience for them to even ask for volunteers from the students as well as others for like the faculty. Oh gosh, I don't know what else to say. Hold on.
What have you learned during today's vaccine clinic?
Today I learned that it's really important to be organized, have your stuff set up. I feel like for these clinics it's very important to be really organized and have your stuff set up before you start administering vaccines, And I feel like also as a vaccinator, it's very important to show confidence in what you're doing in order for the client to feel less nervous. I know a lot of people come in feeling nervous even if it's after their second COVID shot. And I feel like if you're able to talk to them, ask them what their experience, what their first one is, or even just show confidence, then they're gonna be less nervous when receiving it. Today we did a pre-conference and we kind of talked about our job, our insight, what we're gonna be doing, and then we all gathered together as a whole group and kind of just made sure everyone was there, talked about what we're doing, then we separated and we each taught each other what we should be doing at each station, such as verifying their name and date of birth. It can go from that to making sure their immunization card is all filled out, and then just prepping the station. And then we also on the side had vaccine preppers who basically made sure the vaccine was not expired, prepped it for us, and then handed it over to us. And then we as vaccinators vaccinated people. But I'm really thankful that my school is able to help the community and everyone around it with the vaccines.
Thank you, Gabriella, for allowing us to hear your insights. Okay. Do you wanted to say a few words to our listeners out there to encourage them to get their vaccine?
I really encourage everyone to get their vaccine because not only is it protecting yourself, but it's protecting everyone around you as well.
Thank you. Here are some of my colleagues, Dr. Manas Mandal and B from HR, and she's volunteering in the post-vaccination area.
Hi, Dr. Christina Madison here, the public health pharmacist. Just want to encourage everyone out there to get vaccinated. It's Lunar New Year, so gum hei fat choi. Make sure that you have a blessed and prosperous year. The best thing that you can do is to get vaccinated.
Thank you. So this is the first station where you have to register. And then after registering, then you have to go through verifying information for any contraindications for receiving the vaccination.
Oh, sorry. Okay. Hi, I'm Tita.
Hi, my name is Dan.
We're students at Roseman University. We're here at the Roseman Clinic getting our vaccinations for the COVID-19. This will be my first one, and also for Dan.
It'll be my first one, and I'm looking forward to it.
We just want to encourage the public to start getting their vaccinations done. We've been doing it today, volunteering, and no one's been telling us that it's been painful, so we're excited to get it done.
Yeah, so Tita and Dan were vaccinators today. So tell us, Dan, your experience as a vaccinator.
It's been a very positive experience. Everybody was reported that they had a positive experience, and they really were grateful that they had the opportunity to get vaccinated, to be safe.
So listeners out there, we are trying to get our shots too today after volunteering for the whole day. So Dan had volunteered for the half day in the afternoon. So we are the last shift of giving vaccinations to the community. So any other words of wisdom for the listeners out there regarding the
As
vaccination?
soon as you get an opportunity, come and get your vaccination, and you'll be safe and not sorry.
And there you have it. Thank you, Dan.
Alright, so this guy's name is Aczon-Armstrong. Correct. Na no secure anybody here with you?
No.
Received COVID vaccine before?
No.
Had a severe like reaction?
No.
Hospital in
No.
Have had a positive COVID-19 test? Okay. Have a weekend immune system?
No.
Have a pregnant
No. Thank goodness.
I'm not sure I am. It's not that bad. We'll see.
This may or may not be wrong for you, but for me, fever, chills, muscle aches, body aches. Yeah. Get it over with? Definitely Tylenol. It's a good fix of your Tylenol, do your friend, probably tomorrow. Okay.
All right, we're ready? Oh, yeah. Well then.
You're welcome.
Oh, you want to turn it off? You're the owner of the radio.
And Dr. Akria, geez.
I'm getting all the professors and the deans to
There you go. Shows up your confidence.
I got threatened when I did boxing.
Very good. Excellent. I didn't even feel it. It was just a little cold, that's it. See, it's not bad. Get your vaccination right now. Yeah. It's available to you. Thank you. So this is Priya who gave you her injection. She did an excellent job. I didn't even feel it. So can you tell our listeners to encourage them to get their second shot, their COVID vaccination?
Yes, please get vaccinated for COVID-19. It's great for everyone, for you and the community. Thank you.
And thank you for your service.
Oh, you're welcome.
So we had a really busy vaccine clinic, and I just wanted to share that, including, in addition to the photos and video snippet that we had shared, that there are different roles of the team who had served the community yesterday, 300 plus COVID-19 vaccination. It's the Moderna vaccine that were provided to the community. Majority of the community members who participated were 70 plus, as well as individuals who are getting their second dose. There were a few who got their first dose, and that's including myself. And everyone in the vaccine clinic team are all volunteers. We start with volunteers who are in the registrar. So when you come in, you will have to be filling out a form, or if you have scheduled your appointment online, you will be instructed to print out the pre-checklist form. And the registrar will enter your information in the computer system, including your name and your birth date, and information that needs to be data entered into the WebIS, which is the Southern Nevada Health District data record, where you can retrieve your record of immunizations. So after you register at the registrar section, you will be instructed to again wait in line for the actual people who will verify your information on the form, the pre-check form. there will be at least 3 times that you will be checked off to make sure that all the information on your register form is accurate and complete and legible, so that when the data entry people put it in the computer, all the information are accurate. And after you get checked off, then you will be led to the people who are vaccinating. And you don't see it in the background, but before the vaccines are distributed to the vaccinators, it is prepared and checked off. We have a group of volunteers who are vaccine prepped, who are actually withdrawing the vaccines into the syringe and ready for the vaccinators to give to the public. And there's a really rigorous process to handle the vaccines. And I am so amazed how organized it is. So thank you, Dr. Christina Madison, for your video snippet and encouraging our community to get their vaccinations when it becomes available to them. And one of the things that I wanted to share is also, after you get vaccinated, you will have to wait 15 minutes in the waiting room to be observed by the adverse reaction of servers. So we had to follow a really rigorous protocol, and so they have to look at any signs and symptoms of any severe reaction. And some are reactions are expected, like soreness, redness, and itching and swelling at the injection site. And maybe there's slight bleeding, especially for those who are taking blood thinners for their condition. So if that happens, you can just apply pressure and you can add adhesive compress over the injection site. If there is continuous bleeding, then you have to place a thicker gauze pads onto your arm. Right before the injection is given, sometimes people are very anxious about it and they may feel faintness, like lightheadedness, dizziness, or feeling weak or nauseated, or having some visual disturbance. So those are some psychological fright, and sometimes we call it syncope. So we just have the patient lie down or after the vaccination. And the worst reaction would be what we call anaphylactic shock or anaphylaxis. The skin and the mucosas you have generalized hives, itching, flushing, and sometimes swelling of the lips and the face and the throat and the eyes. And for respiratory symptoms, sometimes you have nasal congestion and maybe change in voice, also sensation in throat, like it's feeling like your throat is closing in, shortness of breath, wheezing, or coughing. Sometimes you will experience nausea and vomiting, and even diarrhea and cramping, abdominal cramping, like when you have for women, when you have your monthly menstruation. And sometimes the heart is also affected. For those, maybe you may experience collapsing or dizziness, or your heart is racing. We call it tachycardia when your heart rate is increasing. And sometimes you can have like low blood pressure and what we call hypertension. Some of the things that I can share to all our listeners is about some of the requirements and information that was provided during our vaccine clinic. There were questions about if the person already have been tested positive, but they were not showing any signs and symptoms. Should they get vaccinated? Of course, because you can get reinfected again, or and even so, it will be worse the second time around that you get infected. So for the Moderna vaccine, the government authorities recommended for the Moderna vaccine, the individuals who tested positive for COVID, you should defer at least 90 days before you get the vaccination. That's the time that you were tested positive for the COVID. Also, if you have received antibody therapy when you tested positive for COVID-19 and had some symptoms, the antibody therapy is the monoclonal antibodies or the convalescent plasma that was part of the COVID-19 treatment. So you should defer getting the vaccination within that 90 days. Also, for individuals who have cancer, it's recommended that you check with your oncology doctor or cancer doctor just to make sure that it is safe for you. And those who are, again, receiving blood thinners, you can still receive the vaccination, but the thing is you will have more chances of having bruising on the site, and maybe you have more bleeding on the site as well. So you just put a lot of pressure on it and just monitor it. For the severe allergic reaction, because you had a previous dose of any of the vaccine, we use precaution, and during the vaccination process, the vaccinators who are giving you the vaccine will give you some information about what to expect. So there you have it, our listeners. So we encourage you to get your vaccines when it becomes available to you. If you need more information, there are a lot of websites who can give you some information. The Southern Nevada Health District, and I'm speaking to our local community here in Southern Nevada, that there is the website, and the web is the portal that we use here in Nevada for you to be able to retrieve your information. So thank you again for listening to our program. And remember, every Monday is a healthy Monday. Aloha.